been stuck with a medical bill you thought your insurance was going to pay but didn't? Well, tonight you can count yourself among millions in the same boat.
And it's a boat that appears to be sinking fast. ABC 15's investigator Lisa Fletcher with a disturbingly common problem that is destroying credit and forcing people into bankruptcy.
Nearly 60% of all bankruptcies are because of medical bills. But what if the bill should have been paid by your insurance and wasn't? Or the hospital charged you a rate virtually no one pays? It happens when you don't know what you're entitled to. Brian Sharp injured his eye and needed emergency treatment.
They accepted my insurance at the time that I checked in.
But by the time it was all said and done, Brian had bills, not co-pays or deductibles, but bills totaling more than $19,000.
Because an insurance company saying that they'll pay doesn't mean that they'll actually pay.
John Metz is the executive director of Just Health, a nonprofit that helps people who get taken advantage of by hospitals, doctors, and insurance companies.
The vast majority of people don't understand that they've been wronged.
Charles Croston went in for a routine procedure. He knew his providers were all under his insurance policy.
But lo and behold, they used a doctor who was not part of that system. So he billed me separately and said $1,850.
Charles was never told the hospital could substitute with a doctor outside his plan. He only figured it out on his way into surgery.
He's been given anesthetic already. He's about to fall asleep. And then what's he going to do exactly? So whose responsibility is it? It's my belief that the responsibility lies with the providers.
Here's what we discovered that most people don't know. Just because the hospital takes your insurance doesn't mean you're covered. Most hospitals contract with groups of doctors who are not their employees, like anesthesiologists, radiologists, and ER doctors. And in many cases, they can each charge you separately for whatever amount they want.
If they want to say, look, you come to our hospital and we are going to squeeze every dime out of you that we can get, well, at least I would be honest.
And if you don't have health insurance or are caught in between having coverage like Liz and Eric Kuhl, this gets so much worse.
The consequences of not informing people can be worse than the disease.
Not long ago, Eric went into the ER for kidney stones.
And I was just in really excruciating pain.
One prescription, 2 CT scans, and 45 minutes of treatment later, he was back home. Bills arrived, and Eric and his wife Liz paid them. But what they didn't expect was an enormous, unitemized bill from St. Joseph's Hospital, Catholic Healthcare West. Remember, Eric was only there about an hour and already paid all the doctors.
I was so shocked when we got the bill. I was just like, unbelievable. It was over $5,000.
To make it worse, the Kuhls say the hospital sent it to collections before the bill was even due.
And Catholic Healthcare West was sued in California for virtually the same kind of conduct.
So we asked our advocate to try to help the Kuhls. He went straight to 3 of the top dogs at St. Joe's Catholic Healthcare West.
Linda Hunt, please. I'm trying to get through to Linda Hunt. I need to speak with Linda. Is this Jack Chapman? I would like to speak to Lloyd Dean, that it does not have to be this way.
So if it's this hard for a guy whose job it is to get results, imagine the frustration for everyone else who fights this on their own.
I just think it's a shame that we have to engage in a battle like this in order to get adequate health care at a reasonable cost.